the most common symptom is no symptom. And so that's why it's important that those screenings happen, or if we have a new partner that's on board now, that these screening tests are done.
Hello, everyone. This is Dr. Nita Luanga. I'm here with my friend, Dr. Loretta Duggan. She is a primary care physician that's trained in family medicine and adolescent medicine. Her focus is on teen and young adult health and reproductive and sexual health. I'm so excited to have her here today with us and to share what she does with us and share some of her tips and information with all of you guys. Welcome, Dr. Duggan. Please introduce yourself and tell us a little bit more about yourself.
Absolutely. Dr. Luanga, thank you so much for having me today. I'm so excited for our conversation. And hello, everyone. My name is Dr. Loretta Duggan. As Dr. Nita mentioned, family and adolescent medicine trained. And I'm also the CEO and founder of Her Health, located in Athens, Georgia. And at Her Health, we help 11 to 26-year-old young ladies to confidently embrace their menstrual, their reproductive, and sexual health to live the life they choose. So really excited about different topics that we'll talk about today and the importance really of what it is that I do.
So tell me a little bit about how you made the journey to focus on reproductive and sexual health.
Yes, so let me tell you, this was not the goal. This was not the end game at all. I did not see my medical career going in this direction. So I first found medicine when I was 7. I lost my grandma. She had a massive heart attack. So for me, I got very curious as to what happened, number one. And number two, how can we prevent this from happening to other folks? How can we prevent this from happening in other families so that they don't have to experience that loss and that pain like I did? So that carried me so far through my medical journey, even up until this point. But what I came to realize was that I had my own story as well. I had my own struggles with my periods. They were so painful to the point we're doubled over. We were taking all the stuff over the counter and just like nothing is working. My poor kidneys, we popped a lead like Tic Tacs. Like where we could try to help with the pain, that's what we did. But when I was in residency training for family medicine, and it's 3 years, I was in my second year, we were doing our women's health OB rotation. That's when I learned about different conditions like painful periods, dysmenorrhea, like heavy periods, irregular periods, and how hormonal therapy can play into that. So I'm like, hold on, now I have my own diagnosis. You know how we do, we self-diagnose ourselves. So it's like I have my own diagnosis, and now there's a treatment for it through hormonal therapy that can be so much more helpful for me. And if I, being a whole doctor now, am training and I didn't know about this, how many other people are suffering with this as well and just don't know? And they just don't know. And so that became a bigger purpose for what it was I felt that I wanted to do, but I wasn't sure how to incorporate that or what it would look like at all. And then the second thing was that I really love talking with my teenagers. I love just learning so much from them. And now it helped me to restructure what I thought preventive medicine could be, what it could look like. Because now I can catch them so much earlier on the front end to help affect change, to help them with preventing pregnancy until they're ready, to help them make sure that they're screened. I'm like, hey, it's a new partner. I know we screened you last year, but it's somebody different. So we need to retest you again. We can have those conversations and not just wait until now we're 50, 60, 100. Not that I didn't love caring for those patients too, but I just had a special place in my heart for my teenagers. And learning about adolescent medicine as a subspecialty, where now I can focus just on teenagers and what they needed, was like awesome for me. It's like the best thing. And so doing that adolescent medicine fellowship, in addition to family medicine, it was indirectly leading me to the place where I am now. But I never would have saw that or envisioned that as my medical career. But here we are. Her Health, she's here, and we're loving it. We're really excited.
Speaking of what you envisioned as a child, did you envision yourself becoming a doctor? And if so, what did you think your path was going to be? Because it sounds like reproductive and health and sexual medicine was not the path that you intended to go on.
Not even close. because one, it wasn't talked about. I'm born in rural Georgia. We're in the South. Folks just didn't talk about it. We weren't talking about puberty and what's going to happen. We weren't talking about periods. And my doctor didn't ask me about my periods. So they didn't ask and I didn't volunteer to tell. It was just like, all right, you just figure out how to deal with it and do whatever else that you need to do. As far as medicine, I'm a first generation medical doc. So I didn't have anyone in my family to be like, this is what it can look like. This is the pathway to do it. It was literally step by step, piece by piece. Okay, you say I got to go to college 4 years. All right, I went to college. Check. You say I got to take this test to get into school. Okay, check. We're going to do that. So literally, it's just checking the boxes along the way to try to get to that state where we're doing full blown primary care. But again, it's about exposure. It's about increasing that knowledge. And by doing that, now I realize, okay, I have options of what family medicine can look like for me. I have options in terms of how I can best serve my teenagers. And when I first graduated in terms of attending hood, that's when we're able to essentially be on our own practicing. I was at what's called a federally qualified healthcare center, FQHC. So we see everyone, regardless of their ability to pay, regardless of them having insurance or not. So we're seeing some complex cases. And for me, in the clinic where I was, the second place where I was the only physician there, and then had nurse practitioners. And we would see some complex things and just managing a team and learning how to coordinate care, realizing that we're that bridge between all the specialists that people see. These are the things in medicine that we don't know about until we're in it. And so again, all the while, and I did that for 6.5 years before deciding to open private practice. But when I look back, now I realize that it was all training me and getting me ready for the path that I'm on right now, which I think is such a beautiful thing, and having that hindsight and then continuing now the same momentum to move forward in literally building a medical practice from scratch and then teaching people about what adolescent medicine is. There's so many, I won't say so many, but there are numerous adolescent medicine specialties, and we treat certain conditions as well. When I say specialties, specialists rather, but we treat conditions from gynecology issues like menstrual health, like reproductive sexual health, but we can also help with eating disorders. Others may help with substance use as well, mental health problems in that age, from anxiety, depression, bipolar, and above. So for myself, I personally have decided to focus on gynecology care, but for others in maybe larger academic centers, larger hospitals, they may be focused on a wide breadth and variety of things, again, just for teens and young adults. So if that's something that you feel you need for your tween, teen, or young adult, definitely seek out an adolescent medicine person, because they can be what they need to thrive.
So in your particular practice, because you mentioned, and I didn't realize that individuals who specialize in adolescent medicine may focus, say, on eating disorders or gynecology. I had no idea, so thank you for sharing that with us. But in your practice, what are some of the common medical conditions that you see and that you enjoy taking care of?
Absolutely. So from painful periods, heavy periods, irregular periods, I want to be able to help all ladies with those things and work those things up. I said, for me, talking about our period was just not on the radar when I went to the doctor. And now I'm making sure to ask, okay, when was your last menstrual period? Because our periods can tell us so much just about our health in general. If we're skipping periods at a time, we're 3 months, 6 months, a year out. Okay, what is going on? We want to figure that out. Are we dealing with PCOS? Of course, we want to rule out pregnancy, right? But after we rule that out, are we dealing with a PCOS picture? Could it be a thyroid issue that's going on? If we have someone that may be restricting their calories and excess exercise, are we dealing with an eating disorder now? There are any number of things that could be going on that we learn just from asking about, how are your periods doing? How heavy are they? How often are you having to change? And you're not changing just because you want to be like clean. No, you're changing because your pad is running over, or your tampon is bleeding through, or whatever the case, whichever type of product that you use when your periods are on. And so to know that now they have a trusted resource, they have a safe space where they can talk about these things, I think it's just so important. And it really highlights the importance of what I do, because oftentimes no one else is really talking about it. And if they aren't, then who are they getting information from, right? If they're not hearing it from their families, I know for school systems here, where there is no comprehensive sexual education that's going on. You have your peers, but they're all going through it together with you. So they really don't know either. And then, of course, you have social media, and it's so much that's out there, which I understand now the importance of me being on social media, because we want to help dispel and cancel out some of that misinformation that so can be so widespread on the web as well. So yes, we definitely ask about periods. We definitely focus on them to give us a general idea of how their health is doing, and then two, how we can best help them as well.
Speaking of periods, there's potentially going to be a lot of parents watching this. If there's a parent that is worried about their child, they're not sure how to talk to their child about their periods, how would you suggest they perhaps bridge the conversation this with their child, and or even encourage their child to go talk to the doctor, to come to see you and come and have this conversation with you?
I would say start where that kid is. If they haven't quite started their periods yet, but you know that now we're talking about bras and training bras and things, the period is on the way. Okay. So you can let them know, hey, I know and see that you're changing. Is there anything that you would like to talk about further as your body continues to change? Or is it something that you and your peers have already talked about, you and your friends have started talking about? Or have some of your friends already started their periods? How does that make you feel? Or how are they handling it? And knowing kind of what's normal and what's not with the period. So for instance, when they come to see me, I want to know, how long are your periods lasting? Typically it's going to be around a week. Some may be shorter, but now we're going longer than 7 days. Okay, we may need to talk about that sooner, or we may need to talk about that with the doctor sooner. If you're having pain, does the medicine we give you help you with your pain or not? And if it's not, encourage them to let you know about it. Keep the door open so that they know, okay, this actually isn't normal that I'm feeling sick on my periods, or that I can't go to school, to know that this is something that we want to watch out for if that's happening to you. And then two, how heavy are you bleeding? Are you overflowing into your clothes, onto the bed sheets? Are you having to change about every hour or two? Those can all be signs of, hey, this period isn't acting the way we would typically expect it to. So really asking them, how are they dealing with it? How are they managing? How'd your period treat you this month? It was awful. Okay, what was awful about it? Talk to me, talk through it, because they may be experiencing things that you went through, or it could be they're having things that you didn't go through that you didn't realize wasn't normal. In that way, that can help bridge the conversations. Okay, let's go talk to the doctor about this too. Let's make sure we're all on the same page and we understand if we need to do something different or not. So it's being open about it. If you can bring in peers, sometimes they'll be more open to talk about friends instead of talking about their own situations, right? Because of my friend, or my friend going through this. But that can open the door for them to share more with parents as well.
That's really good advice. I think it's always not easy. It's not easy for parents to have these kind of conversations with their children, but I really like your advice. And I really like the fact that parents have the option of also bringing their children in and having this conversation together. Speaking of heavy periods, what are some of the things or primary causes of heavy periods, if you think, or even abnormal periods that you think parents should be aware of?
So when thinking of heavy periods, so are we dealing with a bleeding disorder issue? Sometimes thyroid issues can masquerade as that as well. In our ladies and ladies of color, are we possibly dealing with fibroids as well? Any masses or growths that could be present? Those are things that are often picked up on imaging that we can see. Sometimes there's endometriosis as well. You're having heavier, more painful periods that are there. And even with PCOS, because if they're skipping months, but the lining is still building up, when they do have a period, it may be heavier that time as the lining is being shed. So there are any number of things that we can look at, try to help figure out. Definitely check labs too, because if we're having heavier periods, we want to look out for anemia. We don't want those blood counts to get too low as a result of them having like heavier bleeding. But from heavier to to irregular, painful bleeding, really these are some of the things that we look for in all of those scenarios to try to help figure out what may be the best option in terms of developing a plan to start treating and helping to improve their quality of life.
You mentioned the condition PCOS that some of our audience might not know about, or maybe they've heard the term and they don't really understand what PCOS is. Please tell us a little bit more about PCOS.
Yes, polycystic ovarian syndrome. May or may not have the cyst, but hey, it's in the name. So we're all still going with it. But with it, the criteria, you need 2 out of 3. And so with that, the first thing that we often notice is a change in the period. It can be irregular or it may be no periods at all. So we're having some type of what we call ovulatory dysfunction, where normally around the halfway point in your period, you're releasing an egg to ovulate. That egg, that's 50% of the puzzle that's needed in terms of an egg being fertilized and going on to have a pregnancy. But in these cases, they're not releasing an egg, they're not going through the ovulation. So therefore, that period can be irregular or no periods at all. So that's one of the first things with the criteria. Secondly, we can have what's called hyperandrogenism, and that's elevated testosterone levels, elevated androgen levels that we can see either on blood work or sometimes clinically we can pick up on signs of it as well, like acne that's really hard to treat. The typical things aren't as helpful for it. Or 2, something called hirsutism, where you have excess hair that's growing. It may be mustache, underneath the chin area, on the stomach, thighs, legs, arms. It's just really hard to keep that hair away. You're shaving, you're doing all the things, waxing, and it's still like just you're having a hard time struggling with it, hirsutism. So that may be a sign of elevated androgen levels as well. And then thirdly, on ultrasound, sometimes we can see changes on the ovary or how heavy the ovaries are. So you may have a lot of immature follicles that are hanging out. So those follicles go on to become a mature egg, but if they aren't maturing, they're hanging out, you may have what's called a string of pearls that's present on that ultrasound. But again, 2 out of the 3 are needed. Sometimes you may or may not have any findings on the ultrasound, and that's okay. But if you meet the criteria for 2, then we're likely dealing with the diagnosis of PCOS, or polycystic ovarian syndrome.
So once somebody is diagnosed with PCOS, what can be done? What are some of the treatments that you would advise your patients to start on to help them manage this condition?
Right. So and just like with all conditions, we want to start with what is the patient's kind of end goal. So for some, it may be I want to regulate my periods. Okay, great. We can definitely help with that. For others, it may be, I just want to make sure that I'm the healthiest I can be. I don't want to try any medications. Okay, maybe we can focus just solely on lifestyle changes, our diet, how much we're exercising. And again, with PCOS, not most, but some can be overweight. Some notice a change in their weight where they gain weight and they just don't know why. So working on those lifestyle things can be really helpful sometimes in those cases. Not all, but sometimes they can. And we definitely recommend it for everyone, regardless of where they are in their PCOS journey. And then for others, maybe that with the hirsutism, that's really bothersome for them, and the acne. Okay, let's see how we can best treat those things as well. Or others, and they may be, usually they're typically older patients, but they may actually be trying for pregnancy. So we can try medicines to see how we can best help them with their fertility and trying to overcome that with their PCOS condition. So it's really going to depend on what the patient really wants, what's most bothersome for them. And then in combination with, okay, we're not skipping periods like more than 3 to 4 months at a time while we're trying to figure this out, so that we can hopefully help prevent that super heavy bleeding, prevent that over buildup of the lining and things like that.
Are there any supplements that individuals with PCOS can take to help manage their symptoms?
One of the things that we can see in PCOS are certain things like elevated insulin levels. For instance, you may see insulin resistance going on, and that can predispose them to diabetes down the line. You also can see maybe increased risk of, say, heart disease later on down the line too. So that's why it's important to catch catch it earlier. One of the supplements that's been talked about, and it can be used in our teens as well as our adults too, the inositol. That one can help with the elevated insulin levels as well. So that is one of the common supplements that's sometimes started. Let's say if someone doesn't want to consider like hormonal therapy, like possibly or contraceptive pills, that can be helpful for sure, but that may not be the first route that they want to start. So we can have a conversation about supplements in those cases.
That's great. And for individuals that are having acne, what are some of the things that they might, or you might suggest for them to manage the acne associated with PCOS?
So acne definitely can be super bothersome. They may try the Noxzema or benzoyl peroxide over the counter and things like that. But oral contraceptive pills, they've been found to work beautifully to help with acne in folks with and without PCOS. So let's say if we are dealing with PCOS, what oral contraceptive pills are going to do, which have hormones in them, but what they're going to do, and we're talking about the combined oral contraceptives, let me clarify that. So it's going to have estrogen and progestin in it. It's that estrogen is really being helpful in those cases to help improve their acne. It's going to help to regulate their periods. It's going to help to make sure they're not having super heavy bleeds as well. So it can help with a lot of the different symptoms that come along with PCOS, in addition to helping to regulate their periods and helping to lower those testosterone levels if they're a little bit high as well.
That is great. Now I'm going to shift our conversation more to sexual health. So what are some of the common STIs? And this term keeps changing. It used to be STDs. Now I think it's STIs. I'm not sure if they changed again. But what are some of the common STIs that you help your patients with? I just wanted to mention, at least in the health region that I'm in, we've seen a resurgence of syphilis. So I'm very curious to hear what you're seeing regionally or even hearing nationally. Please go ahead and share with us.
Yes. So sexually transmitted infections, they are definitely still prevalent. And you mentioned STIs and STDs. So sexually transmitted infections, I like to think of that they're still more local. So you may or may not be having symptoms now. Usually you're not. And we're doing a screening or we're testing for something else. Maybe we did your pap smear and we're like, oh, by the way, it came back positive for this. We need to talk about what's been going on here and partners being treated and all the things. So that's why I think of like the sexual infections being local. And then sexually transmitted diseases, I'm thinking now there may have been some spread in that local infection. So now we may be having symptoms. Okay, I'm having pelvic pain. I may be having some discharge now. So it's not just in the local area where it was, but now it's starting to spread and we're starting to see symptoms with the sexually transmitted disease. So that's how I try to separate them now. But I was confused too for a while when they were switching things up. And definitely some of the common ones, which again, I love helping to treat and take care of and make sure folks are screened. And we talk about this because a lot of times with sexually transmitted infections, they may have no symptoms at all. The most common symptom is no symptom. And so that's why it's important that those screenings happen, or if we have a new partner that's on board now, that these screening tests are done. Some common ones for sure, like bacterial or chlamydia, gonorrhea. You mentioned syphilis as well, which there definitely was a resurgence of syphilis over the pandemic when COVID really was at an all-time high, and even started to see congenital syphilis. So now syphilis was happening in the babies as well. And as a result, our screening rules in pregnancy have changed. Where now, yes, we're testing before, but we're also testing third trimester and at labor as well. They just don't want to miss it, which I think is a good thing because it definitely is treatable. Then we have trichomonas, which is a parasite. It can be treated as well. And then we have our viruses to think about. So we're thinking about herpes virus, thinking about HIV, thinking about human papillomavirus, HPV, and hepatitis. And with viruses, not all of them can be cured. So that's something important for folks to know. With the bacterial, we have things to treat it. With trichomonas parasite, we have things that can treat it. And with our viruses, depending on which one it is, we may be able to treat or cure or not. So let's say for herpes. With herpes, we have treatments for it that can help decrease how long your symptoms last or how long an outbreak is, but we can't completely get rid of it once you have it. And it can sometimes just be dormant. It doesn't bother you at all, but it can reemerge later in life, say like with shingles. So that's the deal with herpes. We can help control outbreaks and symptoms, keep yourself healthy, try to not to be stressed. Those things are going to go a long way in keeping herpes in check, but it won't completely go away. Similarly with HIV, they've come so far in terms of treatments for HIV. It's almost like living with a chronic illness, almost like diabetes or so now. If you're able to take your medicines, take them consistently, you can keep HIV under control. But even what's more beautiful with HIV, now we can help prevent it with pre-exposure prophylactic therapies, PrEP therapies now for both men and women. So we can help prevent you from acquiring HIV in the first place, which is beautiful in terms of the medical advances that have happened. With human papillomavirus, HPV, that one we've noticed now that can cause many things from warts to various cancers. They're talking about cervical cancer, anal cancers, oral, head and neck cancers. And so really pushing prevention when it comes to HPV. And again, they've come a long way. We have a vaccine for Gardasil now. It's for HPV called Gardasil that can help protect folks from getting it in the first place or help protect against some of the highest virulent strands of HPV. And so those are some of the things to think about that we look for, that we try to make sure that we screen for so that we can treat and make sure you're on the appropriate treatment for when it comes to dealing with these type of sexually transmitted infections.
Dr. Loretta, I still have so many more questions for you, but in order to respect your time, I should probably bring this episode to a close. But I think I need to have you back because there's too many questions.
I would love to. You just let me know when, because this has been so awesome.
Yes, I wanted to talk about the HPV swab, other STIs and STDs. Like, there's too many other topics. If you guys enjoyed this episode and you have questions for Dr. Duggan, please leave them in the comment section below. But in terms of people finding you, if people want you to be their doctor or they want to follow you on social media, how can people find you and how can they get a hold of you?
Yes, and thank you so much, Dr. Luonga, again for having me. It's been awesome. And hey, have me back at any time. I would love to. In terms of finding me, hey, if you're in the Athens, Georgia area, or if you're in Georgia in general and just want to come visit Athens, come check us out. Her Health is open. We are taking appointments and scheduling people right now. So check us out for sure. And we take insurances also. So you can check out our website, www.herhealthga.com, or also check us out on social media as well, whatever your flavor is, whether it's IG, TikTok, YouTube, at Loretta Duggan MD, or also on Facebook, Dr. Loretta Duggan Her Health.
Thank you once again for being on the show, Dr. Duggan. We'll make sure to put all the links to your website and your social media sites below so that people can find you. And we will definitely have you back in the new year. As I mentioned, I have too many other questions and I'm sure our audience has so many questions, but thank you once again for your time. We really appreciate you taking the time to talk with us.
Can't wait. Talk to you soon.
Bye-bye for now.